So let's take the next question then. A 13 years old girl with a left-sided neck swelling with a history of slow growth since the childhood. The swelling is hard in consistency. What is most likely diagnosis? So let's try to understand what are the information that has been given in this question. Okay. So the swelling is basically hard in nature, right? It's a slow growing since childhood. Also, another information is given regarding the location of the tumor. It's situated somewhere in the left side of the neck, right? Now let's see the options. The options are A, neural tumor, option B, chemodectoma, option C, lipoma, and option D is cystic hygroma. So let's try to exclude the options and let's try to find the answer from excluding the other option, right? So let's start with the option D, that is your cystic hygroma. As all we know, cystic hygroma is basically some congenital swelling that has been seen typically in the neck, right? And it's a soft inconsistency and eventually fluctuant in nature. Okay, so it's a basically soft and fluctuant swelling. So this is what your cystic hygroma is, right? So now the history that has been shared with us in this question, that is not very much consistent with a cystic hygroma, right? So let's rule out this option. Then comes your lipoma. Okay, so your lipoma is also soft inconsistency, but the problem with the lipoma, it's basically associated with a slip sign, right? It's associated with a slip sign. Also, some amount of the compressibility is basically seen with a lipoma. So there is a slip sign that would be positive, right? So this is not again very much consistent with the clinical scenario. Then comes your Chemodectoma. So look, this chemodectoma is basically a tumor of the carotid body, right? So it's a basically carotid body tumor. Now, this chemodectoma eventually associated with some visible pulsation, or you are able to get bruit over this swelling. Okay, so this is what the chemodectoma is. So there is a pulsation that would be present in this cases. Also, you are able to find some bruit in that case, so which is not mentioned in this clinical scenario. So we are able to exclude all these three options, right? So only option that has been left, that is the option in neural tumor. So this is going to be your answer, right? Now let's try to understand few things regarding the neural tumor. Okay, so you can see in this image, so this is your exactly tumor which is eventually located, as it has been mentioned in this image, mentioned in this questions, right? So there is some right or left side of the neck that has been the swelling is there, and it is eventually hard in consistency. Now regarding the neural tumor, they basically arises from the peripheral sheath, peripheral nerve sheath, right? So they could be of two types. One is the schwannomas, another is the neurofibromas, right? So the clinical features they eventually shows, they are the slow growing tumors. So eventually we encounter patients with a multiple neurofibromatosis, like there is a multiple uh, uh, neural tumor that has been spread all over the body in some patient, and the patient eventually comes to us with some kind of concern. And obviously here uh, the patient are supposed to come to you with a typical history, giving that it's been there for around 10 to 15 years, and it will eventually um, growing in size in that case. So this is your slow growing over the years. Also, this kind of tumors are basically firm and hard on palpation. Okay, firm and hard on palpation. It's never going to be a tender swelling. If it is tender swelling, it's not going to be your neural tumor, it would be something else then. Okay, and most of the time the patient came to us with either in the adolescent age or in case of adult age group, because initially the size was pretty much small, so the patient or even the parents of the children are eventually ignores this thing. But as the time goes, the tumor size of the tumor eventually grows as well. Okay, now, the most commonly seen in the lateral portion of the neck. It's a lateral region of the neck. This is the most common site. Now, let's try to understand regarding the schwannomas and the neurofibroma, right? So, your schwannoma is basically benign peripheral nerve sheath tumor. Now, they are eventually encapsulated. You can see in this image, right? So, there is a beautiful encapsulation of this tumor has been seen in that case. So, this is the schwannoma, and the schwannomas are mostly located in eccentric to the nerve. So, you can see in this case that this is the nerve, right? So, this one is the nerve, and the tumor has been located just beside to the nerve, right? So, this is the cross section, this is the cross section, and this one is the nerve for you, and this one is the tumor. This tumor is basically located just at the periphery of the nerve. Okay, so this is what your schwannoma is. So mostly affected all the cranials and the spinal nerves in that case, often displace the surrounding tissue and giving rise to well defined masses in that case. Okay, regarding the neurofibroma, these are uh, also associated with the peripheral nerves as well, and they are much more diffuse in nature. So you can see in this image, so this is the nerve, and somewhere within the substance of the nerve they basically develop. Okay, and they are much more diffuse in nature, and they are eventually non-encapsulated than that of the schwannomas. So as we all know, they basically associated with a 2 syndrome, which is the neurofibromatosis 1 and 2. So eventually patient comes with such syndrome, and there is a multiple neurofibromatosis, as I have already mentioned. Now, regarding the diagnosis, the clue is that it's a slow growing and the hard mass. Okay, these two are supposed to be pretty much important clinical clue. So, in the diagnosis, we have the MRI. Okay, this MRI will eventually shows us like the well circumscribed lesion along the nerve path. Your FNAC could be helpful just to get you the diagnosis, or just to get you the clue regarding the spindles presence of spindle cells in the cytology. And your definitive diagnosis is basically obtained after post surgical resection histopathology. This is going to give you the definitive diagnosis. Okay, so this was regarding your neural tube tumor, and this is your answer in this case. Okay,